With healthcare costs on the increase, there's a growing need for us to take some of the responsibility for looking after ourselves and our loved ones. This program is not intended to replace a healthcare professional's involvement with your care. It should be used with their guidance to enable you to take an active part in your own health. There are a great many things that we can all do. One is to teach people some of the basic home caring skills that have been forgotten since the advent of the modern hospital. If you don't have the ability to care for yourself, or have the family or friend support network needed, then a referral should be made to your regional health authority. This can be done by contacting your doctor, nurse, or any other healthcare professional. A relative or a friend can also help to make the referral. You should never be without assistance. This video is designed to give us all a little insight into the basics of looking after a wound at home safely. It could not have been made without the generous support of the Government Home Care Nurses of Kelowna, British Columbia, Canada. Please take your time in watching this video. Stop it and use the rewind if there's something you don't immediately understand. You are not the first and will definitely not be the last person to have their wound looked after at home. This film is intended for the patient, the family, or even your close friends who wish to help. Most wounds will heal by one of two processes. Bringing the wound edges together using either stitches, metal staples, or tapes. This heals the two sides together quickly, and the drainage should subside within a couple of days. It may only require a protective covering for those few days. A more complicated wound needs to heal from the bottom, sides, then the top. This wound will take longer to heal, will have some drainage, and sometimes can leave more scarring. A few other things you need to know about wounds are: every wound is unique, not only in its location, but also in its causative factors and its healing rate. Usually, if you can't control or remove the cause, it takes longer to heal. Healing varies from one person to another. We are all different. Most minor wounds will heal no matter what we do. Healing may take longer if your physical condition and nutritional status are poor, or if you live in an unclean environment. You may need a health professional's assistance. Many diseases known to man would be effectively contained if we all had the education and opportunity to practice proper hygiene. This goes right down to the realization that if you have a cold, flu, or have just gone to the washroom, every door handle and water tap in the house may be covered in contagious bugs. A sobering fact. Washing your hands is critically important. A proper surgical hand wash used to be up to 10 minutes long. In a home setting, this is not needed, nor would it be readily followed by many. All that is really needed is to roll up your sleeves and give your hands a good scrub for at least 15 seconds with warm water and soap. Make sure to clean between your fingers and have reasonable length, clean fingernails. Gently towel dry your hands with either a clean hand towel or a disposable paper towel. Disposable gloves are the internationally accepted method of dealing with secretions or wounds on other people. But if it's a close relative with no contagious diseases and you already share each other's bugs, then a good hand washing should suffice. Choose the best place in your house to change dressings. Consider the location of your wound. Is it easier to stand, lay, or sit while you tend yourself? Do you need a mirror so you can see the area better? Make sure there's good lighting, low traffic, and that you're in a comfortable position. The place you choose should be a clean, non-cluttered area. Make sure your pets are not snooping in the dressing supplies or sleeping on top of them. Assemble all the things you will need before you start. This will avoid running around looking for something when you're in the middle of your dressing change. If you get flustered, stop. Take a couple of slow, deep breaths to relax, and then continue on. Sometimes going through the procedure first in your mind helps. If your dressing changes are extremely painful, your doctor may have prescribed a painkiller, or the doctor might recommend taking an over-the-counter drug, such as an acetaminophen or an ibuprofen tablet, a half to 3/4 of an hour prior to changing your dressing. This can turn a potential nightmare into a mere chore. You'll need 3 things to do a dressing change: a way to cleanse the wound, a dressing to cover, protect, and absorb drainage from your wound, and some way to securely fasten it. A rule of thumb is that if it drains a lot, then you need a thick, absorbent dressing. If it has only minimal drainage, then a thin one will do. Some wounds may require a non-adhesive dressing if sticking occurs at the time of dressing removal. Please note that some deeper wounds may require packing and should be monitored by your health professional. So, get out a suitable sized dressing, large enough to cover your wound. It should overlap the wound by at least 1 inch, or 2.5 centimeters, and be thick enough to absorb the drainage. There are many very good dressing products on the market that are easy to apply, speed healing, and may be left on for up to a week. Most are expensive, so first discuss their use with your health professional to make sure they suit your particular wound. The longest standing safe material for wounds is gauze. Gauze commonly comes in 2x2 or 4x4 square pieces. You may need several layers for absorbency. For wounds with more drainage, a thick, absorbent outer dressing may be needed. You'll need tape or some other method to attach it, and sometimes scissors. You'll also need a small plastic garbage bag to put the old dressing in. First, remove the old dressing. If you have sensitive skin or skin that's easily injured with repeated application of adhesive materials such as tape, remove the dressings very gently. Moistening the old dressing with a bit of clean, warm water can help loosen it. If you have normal skin and not the need for more than a couple of dressing changes, then a quick removal of the tape is less painful. Examine the dressing closely. As a wound heals, the drainage should typically reduce in amount and become less offensive to look at, and it should not smell. Observe the color, the amount, and the odor of the drainage. Put the old dressing in your plastic garbage bag. A notebook where you date and describe the drainage is a good idea. Look at your wound. Don't be frightened. Everyone is initially scared to look at a wound. It's like diabetics getting used to giving their own needles. After a short time, it gets easier. The 2 main ways to cleanse a wound are using a gentle flow of water, such as a shower, or manually removing the debris by swabbing with a salt and water solution, or saline. Showering is usually a safe and effective way, as long as it's from a clean water source and it's a simple wound. It may even help loosen the old dressing if it's been sticking. Try not to rub soap in the wound and avoid getting your wound in the direct force of the water's spray. Let the shower water gently trickle through the wound. For most simple wounds, this is sufficient cleansing prior to applying a new dressing. If you can't shower or your wound needs additional cleansing, swabbing is the longest standing acceptable method to cleanse a wound. Simply moisten a single gauze pad in the saline solution. Cleanse the center of the wound from one end to the other. You may need to repeat this several times if there's a lot of drainage. Then cleanse the surrounding skin in a circular motion, working outwards from the wound. Use a new gauze for each wipe. Finish by dabbing the excess moisture away with a fresh gauze. Saline can be purchased from a pharmacy or medical supply store, or you can make your own. There's a very simple recipe at the end of the video. 2 warnings. Antiseptic solutions and hydrogen peroxide may be helpful to initially cleanse a contaminated wound, but their repeated use will slow the healing process. And do not use cotton wool on a wound. it leaves fibers in the wound which can interfere with healing. There are several commercial wound cleansing liquids in a spray bottle form which deliver the correct pressure of spray to cleanse a wound properly. Simply spray the wound surface and swab away any excess fluid. These are effective but expensive. There are many good ways of adhering a dressing to a wound. Tape, stretchy stockinette, tensor or clinging roll-on gauze bandages. Can you secure the bandage alone, or do you need an extra pair of hands to assist? For sensitive skin, there are wipes available that will create a protective layer over the skin. These are available at most medical supply stores or pharmacies. Discontinue their use if a skin irritation develops. When you've completed your dressing change, seal up the bag with a twist tie and immediately put it into your garbage can. Then wash your hands. How often do you need to change your dressing? Some good rules of thumb are, if your dressing is soaked through, change it. If it was too thin to begin with, then just reinforce it with another dressing over top. Don't keep adding more and more layers to a heavily draining wound without the awareness of your healthcare professional. If it becomes soiled with stool or wet with urine, then change it. Bugs love the invitation. Most gauze-type dressings should be changed daily. Once there's no drainage or the wound has scabbed over, there is no need for a dressing. If you have stitches or staples, a follow-up appointment with your doctor or nurse should always be made. Contact them sooner if you notice your wound separating or an increasing redness around where the staple or stitches enter the skin. Sometimes tape skin closures may be used to bring two edges of a wound together. They frequently fall off in the shower, so if they become loose, remove them, and as long as the wound has closed, leave them off. After some types of surgeries or procedures, a drain may be left in to let internal fluids out. A plan concerning the care, maintenance, and how long it is to remain in must always be discussed with your doctor or nurse. Try to remember how much drainage it had. Write it down. Infection occurs when certain germs take advantage of favorable growing conditions, such as an open wound, and multiply faster than our immune systems can keep up. The signs and symptoms of infection may include increased wound drainage, especially if it's foul-smelling, pain, swelling and redness near the wound, or an elevated temperature or symptoms of a fever. What can you do to help prevent infection? Wash your hands. A clean living environment will cut down on the number of bacteria present. Make sure your pets are not snooping in the dressing supplies or sleeping on top of them, and that the area you choose for dressing changes is clean and not covered in fur or other animal nasties. In the home setting, the emphasis should be on clean rather than sterile. You may use individually wrapped sterile dressings, but bulk clean dressings are a fraction of the cost and are just as safe and effective. Make sure you store them in a clean, dry place inside the bag they came in. Most local drugstores carry the essential items needed for a dressing change and at a reasonable price. But if your wound needs more than a few changes, and especially if it's more complicated, buy your supplies from a medical supply store or pharmacy that specializes in medical supplies. The better companies have trained staff that know their products and how they work. Shop around, even on the phone. You'll be amazed at the price differences. And many stores will deliver right to your door.
All right, that'll be there this afternoon.
Here's a simple recipe for making your own saline cleansing solution. Clean all your mixing utensils and storage containers by either boiling or dishwashing immediately prior to using them. Boil 1 liter, or around 4 cups of water, for 5 minutes. Add 2 teaspoons of table salt. Mix well till dissolved. Let it cool to room temperature before using. And don't keep any unused solution longer than a week. The body needs a variety of different food types to run efficiently, and it needs even more if it's trying to repair itself. Protein is essential in the process of rebuilding tissue and can be obtained from such foods as meats, eggs, beans, and lentils. A variety of vegetables and fruits are needed to provide the essential vitamins and minerals. In particular, vitamins A and C and the mineral zinc have been proven to aid in wound repair. So getting a multivitamin with zinc from a reputable company is a good idea. Enough fluids, at least 6 to 8 cups of water, milk, or juice a day are needed. And a special note, if you're underweight or losing weight, then your body may not have enough available energy to repair itself. A can of supplement drink may be needed. A referral to a registered dietitian should be made to help choose a dietary program suitable for you. Seek medical assistance when common sense tells you need help. Is your wound not healing properly? Is it getting larger, or is it possibly infected? Are you bleeding excessively? Who should you contact? Contact the health professional that has been most involved with your case. And if you can't reach them, then your local hospital's emergency department can help you.
Remember, it's your life,
your body,
and your wound, so take care of it. Right, Ducky?
Remember, it's your life, your body, and your wound.